folks. So I wasn't able, unfortunately, to get as much time in to this Cluster C lecture as I'd hoped over the past couple days. So what I'm going to do is just put into this playlist the lecture that I gave for last year's class. I'm going to add it to that after this video. But I did want to just take a chance and give you some information about the final so that you have that before you look at the last video, and so you kind of have some sense of what you're getting into. Do go ahead and watch that third cluster video. There is some pretty interesting features of those last three personality disorders, and you might want to use that for your final in fact. So check that out. But I do just want to, again, like I said, talk about the final here. The final's been posted on Blackboard for a little bit now, so you may have already had a look at it. This is just what it looks like. It's mostly blank pieces of paper. And so what I'm really going to be asking you to do here is to really construct, that is to say synthesize, a real person with a psychological disorder. Now when I say real person, I don't mean an actual person. What I don't want you to do is to use this and actually be describing somebody that you know, or even describing yourself. I'm really asking you to be able to call up, to create, to synthesize what types of things can lead to what types of disorders. So what I'm asking you to do is on this first piece, on this first page of the exam, is to provide a diagnosis. You'll see that. If you want to pull this open, pause this and pull this open so you can follow along. That might be helpful. So you're going to provide a diagnosis on those 5 axes. Of course, we talked about that at the very beginning of class, so make sure that you go back and look at your notes about what those 5 axes mean and what you're supposed to put on each of those axes. I do want you to put something on every axis. I want you to put something on each of those lines, and that can be no diagnosis, or within normal limits, or no problems reported. But I just want, one thing I'm checking for here, of course, is just to see that you know how to use that axis. And of course, if you're going to build this into the character that you're going to be putting together, just giving me any of that background or those other pieces of information that might be relevant and help this clinician who might be reading this report understand the diagnosis and understand the history of this person. So you're going to fill out that piece out. Sometimes I tell students you might want to do this last, like you might want to have it in mind, but you might actually want to put the diagnosis on this first page last, because sometimes what happens is a student will put, depression and anxiety. You don't have to put more than one, you can. So maybe they'll put a couple things on here, and then they'll go and they'll start writing up who this person is, and what will happen is they'll maybe forget, or I don't know, just kind of really focus on one and not the other. The reason to do it the other way is because when you write it, then you can go back and read it, and you can say, does this sound like depression to me? If I were just reading this report, would I diagnose this person with depression, or whatever it is that you're going to use? Because what I'm going to be doing is taking this diagnosis and taking what you say in the rest of the video and really thinking about it as a math equation. Does the equation, that is to say, does the write-up that you give me on the last few pages, does it seem to equal the diagnosis that you're giving me on this first page? So I'm looking, and that should maybe give you a clue about the exam broadly, I'm really looking for you to show your work throughout this, and including in your answer or solution, that is to say the diagnosis on the first page, I'm also looking for you to be able to show your work here and provide as many details as you can, such that I can connect those dots to your write-up of this person. So under that provide a diagnosis, it says provide demographics. This is something that we've talked about in this class, thinking about the relationship and the importance in some, if not many cases, of culture and mental health, and how those things can impact, how those things can exacerbate or draw on or help shield, in some cases, the person from certain mental disorders or certain conditions or certain outcomes, as it may be. And at other times, those same identities or different identities may present risk factors to that person regarding those mental health issues. So I'm looking for you to talk about their demographics. So I'm going to ask you for age, I'm going to ask you for sex, that is biological sex versus gender. Then I'm going to ask you for their race. Then I'm going to ask you for their sexual identity or sexual orientation. Then I'm going to ask you for their nationality, maybe just, they're from the United States, but maybe not. I'm going to ask you for their relationship status, single, married, divorced, widowed, whatever. Their religious identity, that just means what religion are they. You could put atheist or non-practicing, of course, Christian or Muslim or whatever. Ability status, that means does the person have any disabilities? These can be physical or mental disabilities, though if it's really a mental disability, of course, you're probably going to put that up top on the provided diagnosis, at least as something that you've noted that the person has talked about in their history. But also you may put it down here, but this may more likely be used for somebody who has a physical disability, they're blind or deaf or something like that. Their occupation, you could of course put student here if you're thinking about writing up a student. And then other, this is just anything else that might be important to that person's identity. For instance, sometimes people will put a note about the SES, the social economic status. So this person is pretty working class, or this person was raised in a lot of wealth and privilege, that type of thing. That might also be important to put in this case together. So then on the next page, you're going to see the client's presenting problem and the client's symptoms. And so what you're doing here are actually a couple of things. The first thing, or the presenting problem, is what does the client show up and say that they're there for? Why are they telling you that they've come in? And then the second piece, and I'll talk about the difference, the second piece is what are the symptoms that you're noticing or that the client is reporting? So the difference between this, the presenting problem is what they're telling you. And sometimes they're going to tell you symptoms. Sometimes they're going to tell you, I'm feeling sad, I can't sleep, I'm eating too much, right? Sometimes they're going to tell you the symptoms almost as they appear in the DSM. Other times they're going to tell you conditions of their life or the thing that they noticed that got them in the door. And it might be your job to put those pieces together. So they might say, I'm fighting with my husband a lot. Or they might say, I don't know, I just haven't been as motivated as I used to be. Or they might say, I just always feel like, I don't know, I'm gonna blow up if somebody says something stupid to me, And so it'll be your job to try to put those things together and figure out what those symptoms are. But I'm asking you in this question to tell me, what do they come in telling you? And what do you make of that in terms of symptoms, right? The big thing that you're doing here again is trying to build your case towards the diagnosis that you give me on this first page. So telling me what they show up with, and then telling me how the clinician might interpret those things. And again, it might just be as simple as the client is coming in and telling you exactly some symptoms. So that rarely happens totally, right? That rarely happens that they just go down the list. They maybe give you a few symptoms and a few just descriptions that you have to assess into symptoms. So it sounds like you're having a hard time getting to sleep, kind of thing. The next piece is a relevant social and clinical history. This is also familial history. So the social history is just things that have happened to them is what I'm asking about. So events of their life. So if they've had any, maybe you're doing a trauma case. So if they've had any trauma in their life, if you're expounding on maybe the type of family that they came from and how that set up their depression or anxieties, if you're maybe talking about the fact that this is their third time in college and they've got some concerns about that or whatever it is, I'm asking you to sort of paint that picture. A little bit more advanced work or a bit more of an advanced conversation is to think about how you're thinking about that disorder and how much history is relevant, right? So something like PTSD, of course, depending on how far ago it was, the history may be incredibly relevant. It's certainly something in their past is relevant, versus maybe something like an anxiety disorder or even a bipolar disorder where the history isn't necessarily as important. The anxiety may be somebody anticipating something, and the bipolar may just be a chemical thing. And so in those ways, history isn't as important as, say, maybe a depression or some type of trauma or something like that. So I want to see something in every box. Let me say that very clearly. I want to see you put something in every box. But there is some versatility in how much you can put in each box, depending on what you think is relevant to the case that you're putting together. Then the next box just says other relevant considerations. This is open for anything. You might be writing an especially long history, and you might want to just put some of that in this box. Of course, you'll be typing it, so the size of the boxes don't really matter. The other thing you might want to put in here are some things about some other notes that you've given. Maybe you've put something in here about their ability status, or you put something in here about their sexual orientation or their race, and some of those things are maybe relevant to that particular case. Maybe you're also putting in something about their job or their near history or something they're anticipating. And so this box again is just for other stuff that doesn't have a particular box, but you feel like it's relevant to the case. Again, put something in every box. Maybe not much is in here, but what else can you think of that's relevant? What else are you investigating? And maybe you just have some questions. The next piece is a really important box, and this is what I'm calling the integration and diagnostic consideration. This is where you're showing your work in particular. So this is where you're going to talk to me about the history. You're going to talk to me about their presenting problems and their symptomology. You're going to talk to me about any of that other information that you gave. And you're going to say, given this and given this and given this, and because we don't quite know this yet, but we do know this, this is why this is the diagnosis that I gave you on that first page. You might also talk about a sophisticated paper similarly to what we talked about with the personality disorder presentations. Might consider some things that you're ruling out. And you don't have to do this, but if you end up writing a case, again, I do suggest writing those first few sections and then coming back and reading it before offering a diagnosis or even offering your integration might be helpful. But using that information to kind of paint that picture for me, because of this, this is the diagnosis I landed on. And even though these things may look like this is a better fit. Even though this might look like a major depressive disorder, because of the angry outburst, it looks more like a mood dysregulation disorder, right? And so you're kind of parsing those things based on what you've told me in the past. But at the very least, you're just building up the one or a few diagnoses that you've given. A prognosis is your sense of what's going to happen. So if you go to a medical doctor and they say you've got the flu, and you say, well, what's the prognosis? The doc's going to say, well, you'll probably be fine in a week or two. If we give you this medication, it might reduce the symptoms. It may speed up your recovery time, but mostly it's just going to reduce your symptoms. You're likely to feel headaches, body aches, sneezing, coughing, feeling tired, right? The prognosis is just like what's going to happen, right? What's going to happen if I don't do anything? What are some of the things that we can do to treat it? What's it going to look like when we're treating it? Or what are the maybe better outcomes if we treat it, right? And so for depression or something, this might look like how long you would expect it to last, what the person is likely to notice in terms of psychological, behavioral, emotional changes, what types of treatments that are available and how those treatments might increase or decrease the person's symptomology over the long and or short term. And so you're really just kind of painting this picture. What's going to happen? What's the answer to the client or the patient's question? What is this? What's going to happen? What can I expect? Right? And you usually give this information before or during the time that you're giving treatment options, which is the next section, so that they can make an informed decision. Right? Do you want to take this medication that's maybe going to make your blood thin, even though you're probably going to be over the flu here in a week or so? Do you want to make that choice, right? So you're just giving them those options, you're giving them those possibilities, and then your treatment plan is your recommendation Of course, this is going to lean on any research, stuff that we've talked about in class, things that you maybe look up before or during the exam even. Don't plagiarize anything, of course, but I don't mind if you're looking up information. That's how I would work if I was working with something relatively new. And so what you're going to do with this treatment plan is give your recommendation, right? Given this person's diagnosis, given the prognosis of what's potentially going to happen with this person, I would recommend therapy for 2 weeks. I would recommend long-term therapy. I would recommend a group therapy. I would recommend they go see a psychiatrist so they can get medication. I would recommend, eating better, getting exercise, whatever it is, right? That's kind of the thing that you're going to offer to them. That's that treatment plan that you're going to give. I think there may be something. This may be an old copy I'm looking at, and I'm thinking there may be something on the new one called Disposition. And the Disposition is something that you're kind of just making up. It may not be on there, or maybe thinking of something else, but if it is, the Disposition just means what did you do, right? So you offer them this treatment plan, and then ultimately, what did you do? This, if it's on there, this is the reason I'm thinking it's not, is you would just really make it up. And that would just be, client agreed to show up for 2 weeks of therapy. They came every other day for those 2 weeks. After those 2 weeks, they felt a reduction in their symptomology, and we decided at that time that they could continue on with their medication, but that therapy was not needed at this time, right? And so that's just kind of like how you left them. The Disposition would be the last piece usually of a client's note. Again, I don't actually think I put it in your final. I think I'm thinking of something else because I really want you to be thinking of this particular document like an intake. That is to say, a first time or maybe a second time that you're meeting with a client. So you're just kind of gathering that first bit of information, painting the picture, thinking about what their treatment would look like, thinking about what their prognosis would look like. Not so much this is somebody you've been seeing for a long, long time, but this is somebody who's come in the first week and told you their story, told you what's wrong, and wants to figure out what they can do to get some help. Okay, so that's it for this, and it's been great, having you. Most of you have been, relatively quiet, but that's fine. Others of you have been very communicative with me, and that's also fine. And so it's been nice talking to some of you and at least reading and grading your papers. So look for the last lecture, which again is on that cluster C personality disorders. It'll follow this video once I have it posted. And again, you can use those for this project. And if anybody hasn't turned in your personality project, please do that very, very soon. But you can also use those cluster C personalities for that project as well. All right, it's been great. I will see you around campus maybe. Otherwise, have a good break.